Hello, everyone, and thank you for tuning into IFFGD's Research Award Winner Series, Where Are They Now? This program was designed not only to acknowledge this year as being IFFGD's 30th anniversary, but to also give us a chance to reconnect with some of our past Research Award winners. And today, we have the pleasure of speaking with Dr. Martin Storr, who is our 2009 IFFGD Research Award winner for Junior Investigator in Basic Science. Thank you so much for joining us today, Dr. Storr.
I'm very happy. Welcome to everybody.
Yeah, so can you tell us just a little bit about yourself, maybe where you're currently located and also your current research focus?
So I received the IFFGD Research Award when I was active at the University of Canada in Calgary, and that is already more than 10 years in the past. And in the meantime, I relocated to Germany. You may have heard that accent. It's a very rough German accent, and I relocated 10 years ago and went to the University of Munich, and there I gained a full professorship for my research and for the teaching. And in the meantime, I still hold that professorship, but I changed my clinical style of practice. I'm now in terms of clinical practice, I'm not an academic investigator anymore. I'm a private practice practitioner in a very close adjunction to a small community hospital. The lucky thing is that I still have protected time to perform research, and so my journey from a basic scientist that I was more than 15 years in the past to a clinical scientist is a very exciting one, and I really enjoy it, and I'm happy to talk to you about that within the next 30 minutes.
Yeah, so thank you so much for sharing that backstory with us. And it is definitely exciting to hear about your transition into clinical science because, as some of our patients who are listening today might not know, but the clinical science, you really have more of a chance to be connected with patients in some of your research activities that you do. So that brings us to our first question of just wondering how maybe did winning the IFFGD Award in 2009 influence your career in research?
Looking back, and I really looked back a week ago when I started working on the questions that you sent me, it changed uh, my job life pretty much, very much actually. When I received the Basic Scientist Award, I was a pure basic scientist. I was working in the field of cannabinoids, and I was doing pure pharmacology in organ bath, in animal research, in vet lab research. And happily, I received a Basic Scientist Award since when you're a young investigator, you a little bit lack the moment of how are you appreciated in the field? How is your visibility? You're pretty much entertained by all the big meetings where you actually present your data, but you never receive a perception, is anybody really appreciating what you do? And that was life-changing with the IFFGD Award since I felt that appreciation. And the interesting thing is I felt that appreciation from a patient-driven organization, and that changed the way of my personal research thinking over the years a lot.
Yeah, it's definitely exciting to be recognized by your peers for all of the hard work. It honestly probably keeps you motivated to still do those things in research. And you're talking a little bit just about how you transition from basic science to clinical science, but can you briefly share with us a little bit about your current research topics that you're working on today?
So my current research topics are based on medications that may help the patients with in irritable bowel syndrome and mind-body therapies that may help people with irritable bowel syndrome. There's a lot of therapies on the market, and there's a lot of good clinical trials already, but many of these techniques never evolved into patient care. So what I try with my team of students to translate that into patient language, to translate that into applications that the patients can really use, and then test it in small clinical trials and deliver it to the patient. Yeah. So mind body is a lot about yoga and IBS. It's about mindfulness, stress reduction. It's all about gut-directed hypnosis, and all these things, very powerful methods. And we translate that into patient language and bring that into the living rooms of the patients. And I'm very happy to do that.
Yeah, and especially in a time like today, where we're still kind of going through the pandemic and living with coronavirus around us, and we're all trying to find ways to kind of cope and manage with our symptoms at home. And some of those things that you're studying may help us understand how can we manage those symptoms at home and not have to go into an office or have to take medications in order to really help with the symptoms. Because as we know, the symptoms can be very burdensome for many patients who are living with GI disorders such as IBS. So when we're talking about some of these strategies that you're introducing in your research studies, what do you hope to gain a better understanding about in terms of GI conditions and how it relates to adult and children population?
So what I'm really interested in, and what drove me the last 5 years is, how do the patients really benefit from what researchers develop? Yeah, since there's a big disconnect between pharmacological researchers that actually do their research on mice and try to develop medications, and the understanding what the patient needs, and that can actually be brought together. Yeah, there's numerous clinical trials on new diets like the FODMAP diet, but there's not a lot of material that is sufficient to explain it to the patients. Yeah,
Mm.
and that is what I learned from IFFGD. That is an institution that tried to translate the current state of the art into patient care, and that is what I was trying for since I got the award. Since then, I'm trying to translate these things into patient care. And I wrote books to patients, I wrote brochures to patients, and I get huge feedback that this is important, and that actually drove my activities.
Yeah, and just being able to translate the science that researchers are doing into readable material for patients is extremely important, because what we're finding in the studies and things, it is very important for patients to be able to understand how it affects them and how does this impact them, which kind of leads me to my next question of what might you consider maybe being your most successful research study that has affected the patient population, and why?
My most successful research publication. I think my most successful research publications, they actually really go back into the basic science. When I did all the cannabinoid research, I had an excellent team where we developed all the anti-inflammatory properties of cannabinoids, where we developed all the pharmacological basics for the motility science and the secretion science in the field of cannabinoids. This part is still not translated into human care. Yeah, there's still lots of things to do, but there is drugs being developed that are based on these cannabinoids that may help patients in hopefully near future.
Yeah, we're so excited to kind of hear about some of those things that are to come, definitely from those studies and from those findings, and finding ways to really help patients manage and treat those symptoms that we've been talking about here. So we were talking briefly at the beginning of this about you winning the IFFGD Award in 2009, but can you talk to us just a little bit about maybe some of the other acknowledgments that you have received while being a researcher?
So besides the IFFGD award, which was my biggest award, yeah, I received the German Gastroenterology Award, which is uh, the biggest German award, but it's not the worldwide visibility of that. And I received a lot of small and minor appreciations for small abstracts or small clinical trials. But I have two major awards, and one is the IFFGD award, and I have it here. Here it
That
is.
that is awesome. Yeah,
Yeah.
and it is extremely important to definitely be recognized in Germany, especially being that that's where you are located. But I think what is a cool thing here is that you not only have a touch in your area, but also in the US of being able to help patients understand what their disorders may be. So just an international effect that you have, an impact that you have in your studies is extremely phenomenal. And we just want to say congratulations to you on all those acknowledgements.
I'm very happy that you say that. May I show something in that video? Yes,
Yes.
since I told you that I wrote patient booklets and informations for patients, and I have that in German language, but
Yes.
that is one of the English translations. That is a Chinese version. So my patient materials goes throughout the planet, and I'm very happy to do that. Yeah, it's this is not expensive, so I don't earn money with that, but that is I just enjoy giving that back what I gained. Yeah, and what I gained is the inspiration and the appreciation of IFFGD, which is a derived, patient-driven organization.
That's very touching, and thank you so much for showing that to us. Because, like you said, the understanding of GI conditions, it shouldn't just stop with the researcher, right? It should be translated into materials and educational formats that patients can to understand their conditions. And just having professionals like yourself understanding the importance and in that, it's extremely gratifying, and just thank you for acknowledging that it is important to translate those things so that patients can understand their conditions as well. And, we talk about the patient community and understanding and wanting to help them better understand GI conditions, but what do you specifically enjoy about being a researcher and being in clinical studies? So what exactly do you enjoy about that?
So in terms of the research, I really enjoy that I'm able to ask questions and answer them myself. And I
Yeah.
ask questions which I feel are important, and then I answer these questions. And on the meetings, we discuss whether it's really that important or whether I have to go in different alleys. That is one point that I enjoy very much. But on the other hand, I'm a physician. Yeah, I'm in private practice, and I see patients every day, and I get all the questions and the understanding of what the patient really wants to ask. The patient is asking a question, but I have the feeling I understand what he wants and give that information back. And that is so important, and that makes me so happy to understand what the need is. That drives me. Yeah.
Yeah, the bottom line of what's the need
Yeah.
for the patients, and being a researcher, you can investigate that. You can actually do the research behind some of the questions that your patients have. And I'm pretty sure that is very invigorating and exciting to know that you can have a part in helping the next patient that comes through your door. So, we're talking about some of the research studies that you're part of, and we're talking about how the GI conditions affect the patient population. So, what do you see as being some of the gap needs in research, and how do you foresee some of these gap needs being fulfilled in your studies and in your lab?
So there's a couple of gap needs. What we learned, especially in the field of functional GI disorders, we learned that there's a huge gap need of are we targeting the right bits and pieces of functional GI disorder pathophysiologies to later on treat the symptoms? And maybe we don't. Maybe we do not know enough about the pathophysiology of these diseases, and that is the reason why we are not able to really develop the right medications. Yeah, we don't only have to develop medications. We can develop mind-body treatments as well. And we learn over the last 10, 15 years that these mind body therapies that actually go strongly into the gut brain axis may even be more powerful. But if we really have that research feeling that that maybe holds true, then we have to translate it into human use. And maybe it's not a single treatment, maybe we need a combination, an individual combination for an individual patient. And there I think we still have to learn a lot.
Yes, there's a lot to learn, definitely in that area, and it's kind of what you're talking about. Would you say that's more of like an integrative approach into medicine, and just figuring out a way to kind of intertwine all of the things that may actually help patients manage and cope with their symptoms?
That is what I strongly believe. I strongly believe that for functional GI disorders, the patient doesn't need a pill. The patient needs a kind of a program that integrates dietary advices, a program that needs integration of lifestyle measures, that has to integrate mind-body treatments, that has to in some extent give some chemical drugs, their medications, but covers all that. The patient actually asks for that, but physicians for a long time only had the prescription block, and that is not the right way.
Yeah, yeah, and it's just what you said before. It's understanding what the patient wants and understanding what the patient needs, and then also just taking a more holistic approach into figuring out how can we treat patients, how can we help them better understand their conditions, similar to what you're saying earlier about your publications and how you're translating all of the research studies that you've done into patient readable materials so that they are able to understand not only just the research that you've done but also their conditions. And so for that, we are extremely grateful to have people in the field like you who are extremely in tune with what the patients want and what the patients need, and really looking for ways to fulfill those gaps in helping patients understand these GI conditions. So we just want to say thank you for all of your hard work that you've done, and we are extremely thankful to have you part of the IFFGD team and just all that you do in the field.
And I will give you a little bit more. So IFFGD is very visible, especially in North America. In Europe, IFFGD is of course not that known since we have different languages. So what did I do when I returned to Germany? With some colleagues, I started develop something IFFGD-like in Germany, and that is called MAGDA right now. So Magen-Darm disease, yeah, which is functional GI disorders. So there's a small IFFGD in Germany now.
Oh, that is so awesome that you're able to take just some of that and make that more of not like what you said, the North America touch, but also giving a little bit to the Germany and just giving just your touch on what IFFGD has to offer. So, just thank you so much for, your time today and just explaining all of your journey through research and your insights in some of this topic and some of these topics. We are extremely grateful for everything that you have done. And just thank you so much for sharing your time with us today.
I'm very happy. Thank you that I was able to speak to you.
Yes. And thank you, everyone who has tuned in to IFFGD's Research Award winner series, Where Are They Now? Where today we've had the pleasure of catching up with Dr. Martin Storr, and we are extremely thankful. Again, thank you so much for joining us.